All right, hi, my name is Lauren Buehler. I'm an endocrinologist here at Conway Medical Center, and I'm here today to talk to you about thyroid cancer. The thyroid is a small butterfly-shaped gland that sits at the base of the neck and wraps around the windpipe or trachea. And the thyroid is responsible for making thyroid hormone, which is important for multiple bodily functions, including metabolism, heart rate, body temperature, and blood pressure, among many other things. Occasionally, thyroid cancer can develop in the gland if the cells there mutate in such a way that creates unregulated spread and results in a tumor. And rarely the tumor can spread to other parts of the neck or the rest of the body. So the good news is that thyroid cancer, in most cases, is slow-growing, treatable, and potentially curable. And it rarely requires any type of systemic chemotherapy or radiation, and is very rarely fatal. There are about 44,000 cases of thyroid cancer diagnosed each year in the United States. Risk factors for development of thyroid cancer include female gender, family history, and any history of high-dose radiation in the past. Thyroid cancer does not usually cause any symptoms in early stages. You might feel a lump in your neck, or it might be noted on a physical exam with your doctor, or noted incidentally on a scan done for another reason. If there's concern for a thyroid nodule, the next step is usually to order a follow-up thyroid ultrasound. And depending on the ultrasound findings, potentially an FNA biopsy of the thyroid as well, which is also called a fine needle aspiration. It is important to note that while thyroid nodules are very common, thyroid cancer is fairly rare, and so most people with thyroid nodules do not have thyroid cancer. If a diagnosis of thyroid cancer is made, generally the first step in treatment is to do surgery to remove the affected gland. Sometimes that is the whole gland, sometimes they only remove part of the gland, and then they also will remove any lymph nodes that are affected. Occasionally, in some cases, we will need to follow up with a radioactive iodine dose after the surgery, and that's designed to wipe out any microscopic bits of thyroid cancer that might be left over after the surgery. The prognosis of thyroid cancer depends largely on the type of thyroid cancer you have, how large the tumor is, and how far it's spread at the time of diagnosis. The most common types of thyroid cancer are papillary and follicular thyroid cancer, and fortunately those have the best prognosis. The more aggressive types of thyroid cancer are very rare. After your initial surgery and treatment of thyroid cancer, it is important to make sure you maintain regular follow-up with your doctor, even if it has been years since your treatment, to make sure that we're monitoring for any sign of cancer recurrence. Fortunately, most types of cancer don't recur or are treatable if they do, and overall thyroid cancer has a good prognosis in most cases.